Welcome everyone to our little mini quarantine webinar with Dr. Rod Page, and I'm Dr. Kelly Diehl, and we're going to try to answer some of your questions that you guys posted on Facebook regarding hemangiosarcoma. And I just want to say thanks to everyone who, first of all, suggested some questions, those of you who piped in about questions that you would like answered, and also thank everyone for participating in the study. I know it's a long haul and a heavy lift, and we truly appreciate it. I am hopefully going to do a good job of flipping slides here for you guys, so I hope you'll bear with me if there's any technical glitches. Again, I'd like to welcome Dr. Rod Page, who, as you guys know only too well, is our Principal Investigator for the Golden Retriever Lifetime Study and Professor of Oncology and Director of the Flint Cancer Center at Colorado State University. And that's sort of an abbreviated version. Rod's got lots of other credentials, and we're happy to have Rod with us today. So hi, Rod.
Hi, Kelly.
So we're going to start with the number one question that was on our website, which is kind of the elephant in the room, which many of you asked: what have we learned so far about hemangiosarcoma in the study?
Well, I think that it's probably safe to say that we still have many open questions about this particular cancer type. That I'll try to talk a little bit about what we have seen so far in this group of dogs as they aged, and some of the types of frequency of hemangiosarcoma through the different ages. But let me first also provide my gratitude to all of the participants and individuals that are involved in a direct or indirect way with this study. It's really a seminal study for cancer in golden retrievers. I think the first time I ever started to really realize what the impact and the burden of cancer was in golden retrievers was probably about mid-'80s, maybe a little bit earlier. And there were times when I was in practice at North Carolina State University veterinary teaching hospital when we would see 6 or 8 golden retrievers a day that had some type of cancer. So it's been around for a long time and has been a problem. I think I don't want to get too far into some of the things we are hoping to find, but we are still fairly early in the process here of following these dogs. We knew that hemangiosarcoma was going to be probably our leading cause of death due to cancer from a study that was done by the Golden Retriever Club of America that was conducted by Larry Glickman. And in that study of only, I think, 1,400 dogs, cancer was the number one cause of death, as we've said before, and about 50 to 60% of those golden retrievers did succumb to cancers, and the 4 primary endpoints that we are following are the tumor types that result in about 80 to 90% of cancer deaths in golden retrievers. So this entire study is built to try and collect enough information to be able to analyze all of the environmental, genetic, nutritional, and lifestyle impacts that may ultimately intersect at the development of cancer in golden retrievers. So we think that hemangiosarcoma may account for as much as half of the dogs in the study that will die of cancer, which is huge. It's a huge problem. And as the dogs have aged through this study, we're now at a point where the average age is about 6. So we have dogs that are 4 years, or most of them aged out of their 4 years, and we have some dogs that are at 9 or 10 years. We have around 50 dogs that have developed hemangiosarcoma, and they began to develop this cancer only about the age of 4 to 6, and it is known that most dogs that develop hemangiosarcoma don't begin to see this type of clinical sign occur until they are generally considered to be close to middle or older age, as opposed to other cancer types like lymphoma, which is often seen at a younger age. So what we can say about it is that this particular population of golden retrievers does seem to be representative of the golden retriever population in general. But as to the actual mechanisms of development or the nature of ways to try and diagnose it earlier, or ways to try and prevent it, we haven't been able to accomplish that yet. And it may take us quite a long time to find those answers.
So thanks for that. The next slide I have here is, this is probably the next most common question we had, which is from several people. Do you know how quickly these tumors arise and grow? I think as a clinician, and I'm sure you see this too, there were many people on Facebook who said, gosh, I just had a checkup 2 months ago, and now my dog died of hemangiosarcoma. So do you have a sense, Rod, how fast these can arise?
I believe that they don't hang around incubating for quite a long time. I believe once they begin to be established as a nodule or as a tumor, they grow rapidly, and that creates some real challenges for early detection. I've experienced having to manage dogs for which the owners are frequently having ultrasounds of either the abdomen or of the heart on a very frequent basis. Sometimes, at one point a few years ago, it was considered maybe an option to consider ultrasounds every 6 months. I think that's probably even too infrequent if we're really going to do something or find some type of nodule that might be possible to find early enough to change the course of the disease. And there are all kinds of confounding issues as well, because trying to identify a tumor inside of the dog's body is really difficult without a biopsy, without doing some kind of invasive procedure. So there are many different types of nodules that can occur in the spleen of dogs that don't necessarily mean that that dog has hemangiosarcoma. So, I think to be as careful as possible to say that I do believe that we may end up finding that ultrasound evaluation of the abdomen may be useful. We don't know the frequency, and it may be an outcome that we need to follow up in the future with a direct study that looks at changing the way we're doing it or making a specific intervention related to the nature of the screening. And as technology changes, there will potentially be ways that we might be able to sort of presumptively diagnose nodules in the abdomen or in other parts of the body. For instance, there are now very ultra-fast CT scans for which you can do an abdomen CT in about 90 seconds. And in many hospitals, many advanced hospitals like here at CSU, it will likely take over the clinical diagnostic capabilities of ultrasound for many different diseases. So there's early detection is tough. We are collecting samples on all of your dogs, so that hopefully we might be able to find an early blood-borne protein or other biomarker that would tell us that the dog is currently experiencing a growth of a hemangiosarcoma. So those are the things that we're currently doing about early detection. We do have some heroes that are being ultrasounded on a regular basis, but I'm not sure that that's going to be a realistic sort of a screening program.
Okay, so, and that was
Mhm.
actually the second question that people
Yeah,
asked. So I'm going to skip on to the next one, which is some people asked about genetic testing and,
yeah,
where we're at. Is anyone looking at it? And, because they brought up like breast cancer in women screening.
yeah. Yeah, well, as you would imagine, there are many different laboratories who have done genetic analysis of hemangiosarcoma tissue from a variety of different studies and different dogs. And there have been some gene mutations or changes in gene structure that have been identified to be relatively common throughout hemangiosarcomas. Right now, it's believed that this is a complex set of uh, problems that exist, probably multiple genetic abnormalities that may ultimately combine to cause a tumor cell to develop. So we are learning more and more about the genetics of the actual tumor. And there are ways that we might be able to even identify some pieces of the tumor DNA circulating in the bloodstream of dogs in the future, which is sometimes called a liquid biopsy. So uh, those are all very important new areas of discovery. Uh, but we know that most of the major centers around the country that are focused on genetics are working hard on trying to define why or what the driving mutations in this disease are for dogs.
And I'm going to add something really quickly that we just talked about in our weekly meeting, which is, and touched on, which is the costs for doing a lot of these genetic tests. They're new tests, so maybe were not even available 10 years ago. And I think for folks who are listening, the costs are coming down for a lot of these tests rapidly. So I think we are going to see I'm hopeful we'll see a jump in this area of research just because it's feasible and cost effective for people to start looking at this stuff.
What we don't have right now, or what we may not have in this particular type of cancer, similar in comparison to breast cancer in women, is a mutation in a gene that's contained in the normal DNA. So all we're able to do right now is to look at the tumor DNA. And once the tumor develops, we can hopefully understand what drives it and develop some treatments for it that we don't have. But for instance, with BRCA1 gene mutations in women that are susceptible to breast cancer, then we know that that's not in the tumor itself. That's in normal circulating DNA, and those women have a much higher risk of developing breast cancer.
Okay, I'm going to go to the next one. And you already answered one, which was the routine ultrasounds. But can you review for folks, because I saw a lot of people asking about this, the normal survival times for dogs with the disease? When we talk about if you do nothing versus surgery, if you
Yeah,
could answer that.
sure. Well, it's pretty well, and I think people are shocked when they see that the onset of clinical symptoms is rapidly followed by very severe and usually fatal events. So, in the progression of this disease, what in retrospect, what we might hear from someone who has a dog that has succumbed to hemangiosarcoma is that there would be periods that they might remember maybe a month ago or 6 weeks ago when the dog seemed a little bit weaker than normal, or was maybe a little bit painful going up the stairs or going when it was playing. And we believe what those episodes represent are smaller nodules that may have ruptured internally and bled a little bit, but not to the level of internal bleeding that causes collapse and death. And recovery from those small bleeds may be then followed by a larger tumor, or maybe a tumor that is located now in a very critical spot. Perhaps the hemangiosarcomas that occur in the heart tissue may often have episodes of bleeding that would go into the membranous sac that helps to protect the heart called the pericardium. And there may be periods when that is not necessarily a severe bleed to create symptoms, but ultimately it is going to be. And same for dogs that have either nodules in their spleen or their liver that will ultimately grow to a point where the bleeding will be sufficient to cause clinical symptoms. And if we're lucky enough to be able to see the patient at a time when we can intervene with a surgical procedure, take the spleen out, take the nodules out, at that point, we do what we call sort of staging. So if the tumor is located only in the spleen, we don't see any nodules in the liver or other organs, or we don't see any nodules that have infiltrated into the membranes around the abdomen, we feel like we have a better indication to consider something like chemotherapy. If you take all the dogs that have this particular disease, from the time it's diagnosed, without any intervention or any treatment, it's only likely that dog has about an average of 1 month of survival time. And that includes those dogs that present with, really fatal hemorrhage, and those that go to surgery and then may live for a few months longer. So that's the average. There are chemotherapeutic agents that have been used. There have been some attempts to use some novel immunotherapeutics or even some herbal medications that have been used. And best case scenario with chemotherapy is an average survival time of about 6 months. That's predominantly for those dogs that have hemangiosarcoma in the abdomen, in the spleen, and the liver. Those dogs that have hemangiosarcoma in the heart tissue are even more difficult to manage. Some of them are surprisingly resectable, surgically resectable. We do have some dogs that have gone through surgery, heart surgery. We can also use radiation therapy in very, very high but very focused doses to reduce the size of the mass. And there have been attempts to try and take out this membrane around the heart so that the heart doesn't get compressed. And the blood that might come from one of these intermittent episodes of bleeding would go into the chest cavity and be absorbed rather than be confined in a balloon bag around the heart and cause the heart to be stressed, and pressure would build up. So overall, it's a very, very poor prognosis. I don't know of anybody who doesn't hate this tumor.
Yeah. So another interesting question that somebody posed and asked is, are there any common findings on postmortem? I think you alluded to them just now, but their specific question was, when you open these dogs up, are there clues to hemangiosarcoma different from other cancers? And you talked a little bit about it, but can you address that when we look at these dogs?
Well, because they are tumors that we think are growing in the perivascular region, they often will shed cells into the blood vessels and can circulate widely. So we would not be surprised if we were to do an autopsy on one of the dogs that died of a splenic hemangiosarcoma to see other nodules, small, medium, large nodules throughout the abdomen, and in most cases throughout the rest of the body. And one of the places, unfortunately, that seems to be commonly targeted for metastasis is the brain. So if we know that there's metastasis, it would be likely that we would see it in the brain as well.
Well, good. Next one. You actually touched on this about prophylactically removing the spleen. And my question is, has anyone actually looked at that? I can't recall, but have you ever seen anything?
No. Nothing in a formal structured study. I began having the conversations with veterinarians or with dog owners about the likelihood of reducing this particular disease by taking the spleen out at a young age. I know that some dogs have gone through that, some veterinarians have done that, but I have not seen a systematic type of an evaluation of any size that would allow us to say that that's going to change the course of the disease. And in fact, actually, there's more evidence now that the origin of these cancer cells may actually not be in the spleen or around the vessels, but they may actually come from cells located in the bone marrow of dogs that are somehow damaged and then are released from the bone marrow and circulate to a wide variety of other tissues that have a high blood flow rate. And so the spleen has a very intricate network of blood vessels and white blood cells and other types of cells that are often functioning as production sites for new red blood cells and new white blood cells. So it's not unlikely that the spleen is maybe just a filter for the rest of the body. And if these abnormal cells are released from the bone marrow, then taking the spleen out is not going to change what happens. I don't believe that, from what I've seen in these few cases that I know about, that the disease has been prevented by taking the spleen out.
Okay, so thanks. Another one people were interested in, I think a lot of folks think about diet. And so many people said something about preventive diets, any change in diet when a dog is diagnosed, and a couple of people asked about keto diets.
Well, I don't think I have too much that I can offer there. There's been a tremendous amount of research done on a diet or a particular supplement that might help to reduce the incidence of cancers or reduce the spread of the cancers, increase survival. Nobody's come up with that yet. I know almost all the major pet food companies are investing heavily in specific foods that are targeted to a particular disease, like joint disease or even cognitive changes in older age dogs, kidney disease, intestinal disease. I think the nutritionists that we've talked to about this particular study don't have and can't offer any particular recommendations about a single diet or a single supplement. But I think most of them agree that having a real high quality, complete and balanced diet is the first step. And then many of them will recommend either some sort of antioxidant supplement, fish oil or vitamin E or other things. There have been some recommendations, some findings in not this type of cancer, but in bladder cancer in dogs and in people now, that eating vegetables reduces the risk of bladder cancer. So in many ways, it's sort of the supplement of some antioxidants. And these are usually what they recommend are usually either vegetables high in carotenoids or in cruciferous vegetables like broccoli that have particular products in them that seem to help manage some of the free radicals that can cause damage. So we've actually seen well-done studies that show that bladder cancer can be reduced in Scottish Terriers by feeding them vegetables, and that has also been shown to occur in people with bladder cancer.
Okay.
So I think that's it's an important thing to remember, though, is that it's unlikely that I believe one diet will ultimately be identified that can be useful for dogs with cancer.
Okay. So the next group of questions that I got are pretty much some treatment questions. And one was, are there any new treatments for hemangiosarcoma on the horizon? And somebody asked about EBAT. So if you want to lump that answer together, you could.
Okay. Well, there are many reports now of clinical trials of varying sizes with sometimes additional chemotherapeutics that have been on the market for many years. There have been very few immunotherapies that have been identified. There are a couple of trials. You know, one of the things that has it kind of came up as a gee whiz type of a thing is there's a process in young children that have a kind of a deforming birth defect that is a vascular effect that can sometimes be very debilitating and quite damaging. But what was discovered is that a very old drug, propranolol, which is used for blood pressure control, can make it can change these birth defects and can really manage them quite well. In fact, in many cases, cure them. And these are benign birth defects. So there was a lot of interest in whether or not something like these blood pressure medications may have what are called off-target effects. Instead of just looking at the blood pressure sensors in the blood vessels, perhaps there are other ways that these drugs could be used. And I know of at least one or two studies looking at these blood pressure drugs around the country in dogs with hemangiosarcoma, in addition to chemotherapy. So the products that are most used are propranolol and a drug called losartan, which is now, I mean, one of the nice things about losartan and propranolol is they're generic now, they're inexpensive, and they're FDA approved, so they're easy to get. So I think those are some hopes that we're hopeful that those will provide some new things. The EBAT is that's a very complex product that was developed at the University of Minnesota and requires extremely well. So I'm going to tell you that I don't know the most up-to-date data on EBAT, but I believe that there's probably a website, there's probably a phone number. I know that Dr. Jaime Modiano at Minnesota and Antonella Borgatti are running these clinical trials at Minnesota. They may be more than happy to answer questions about them, but it does seem to have some activity. It requires pretty elaborate monitoring. But if I say too much more than that, I'll probably exceed my ability to be truthful about that. So I hope it will work, and I think that it may be under development in a company as well.
Good. So here's this $64,000, probably $1 million question. A little bit is a couple of people said, they're pretty well versed in hemangiosarcoma, and they're wondering why prognosis hasn't really gotten much better in a very long time.
Yeah. Well, I mean, that's been perplexing for everybody. Some of it is the fact that it starts off as almost a metastatic disease. So trying to find a systemic treatment for a tumor that is going to result in extremely severe symptoms is it's not trivial. One of the things that probably has held us back also is this is not a tumor that occurs in humans. If it was, there would be so much money and so many clinical trials trying to find new ways of dealing with this that we could leverage that information for our patients. But I wish I could tell you that it's on the verge of changing. but I don't know.
Yeah, that
And
it's
I do know that this study has the best chance of collecting the information for future studies to be able to do something like that.
yeah. So I hope. So the last two, someone wrote, like, I've heard that golden retrievers in other countries don't have as much cancer. Is that true? And if so, have you looked into this?
Mm-hmm. It appears to be true. What the data that we have for golden retrievers that live in Europe and Scandinavia come from predominantly from some of the academic veterinary institutions that are centers for specialty care. But in addition, there is information that is accumulated because of the high number of dogs that have pet health insurance. And so for golden retrievers, the in this pet insurance database have about a 25% risk of dying due to cancer. In the United States, we believe that is about 50%. So that's about half of what we see here, and that seems to be the numbers that are playing out in this particular study. So far, we have 210 dogs that have passed away, and about half of those have died because of cancer so far, and it's still, relatively young cohort of dogs. So it is, it's been looked at. We don't know if there is a genetic or an environmental difference. It appears that hemangiosarcomas in particular are significantly reduced in dogs in that database. And if that's the case, then there's an answer. It's just a matter of trying to figure that out and understand if it's due to excessive breeding pressure for particular traits or particular mutations, or is it some sort of potentially a hormonal effect? We know that in Scandinavia in particular, almost all the dogs are not neutered. So is there some potential protective effect for the development of hemangiosarcoma because a dog maintains their gonads through most of their life, or something else? But that's been a fascinating finding, which has yet to be solved.
And then the last question, and you alluded to this again earlier when you answered the first question, was when do we think we may be publishing more results from the study, particularly about hemangiosarcoma?
Yeah, I know it's frustrating not to be able to see specific study endpoints or conclusions in a process like this. The accumulation of enough data to be able to make sense about something that is consistent requires a lot of dogs to develop this disease, be followed, and to have the analysis done that would allow us to say in that particular group, let's say we have 100 dogs with hemangiosarcoma, we would compare the findings in that particular population, both genetic and environmental, to dogs, another 100 dogs or 200 dogs, or maybe all of the other dogs that don't have hemangiosarcoma, and see what the differences are, and see what happened over the course of that dog's lifetime that might lead us to clues about exposures or hormonal issues or other types of things. So I think that we are about to see a large amount of data be accumulated very quickly now. We have, like I mentioned, we have about 200 dogs that have passed away. We have 3,000, started with 3,000 dogs. So that's less than 10% of our population that has passed away. So as dogs age into the next 3 to 5 years, they will undergo, the normal death rate, normal survival curves. Some of those dogs will succumb to cancers or other types of disorders, and the ones that are succumbing to cancer are going to be able to be used to try and identify differences between those dogs that got cancer and those that didn't. So, unfortunately, it's going to take some more time. And we knew that we needed to do this. There was no other way that we could accumulate this type of information and this set of really important biospecimens to be able to do anything different than what we had been doing for the last 30 years. So I'm hopeful that we will identify a variety of things that allow us to move past such a horrible prognosis into a time when we are able to screen for early detection or prevention or better treatment. But it's still gonna be a while.
Well, thanks, Rod, for helping answer some questions, and thanks for everyone who will eventually hear this recording. And I hope we answered some of your questions. And again, I can't say how much we appreciated everyone reaching out and asking for some just advice and guidance on this. I know it's a really, really tough cancer. It's a terrible cancer, and it's terrible to live through. And I know some of you who are listening have lived through it multiple times. And that's part of the reason you're in the study. And we really, really appreciate it. So take care, everyone. Stay safe. And we'll meet again in Facebook land at some point.
Thank you, Kelly. And thank you to all of the participants.
Yep. Thanks, Rod. All right, everyone, stay safe.